Welcome. Welcome, my dear friends. Myself, Professor Dr. Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp on 9226810 My dear friends, today I am discussing some semi-surgical problem. That means, why semi-surgical, sir? Because such type of the problems are on both sides. We can try first with the medicines. If they work well, that is good. But in some cases, surgery also can be needed. That is why I am saying it is a semi-surgical type of the complaint. So let us talk about today carpal tunnel syndrome. Syndrome is a group of symptoms. Carpal tunnel syndrome, Ayurvedic relief without surgery. Carpal tunnel syndrome, Ayurvedic relief without surgery. Let us see what we can do with Ayurveda. But before that, let me tell you once again that I am Professor Dr. Deshpande. I am Ayurvedic consulting physician. I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp on 9226810 So let us start to discuss about this problem. Can you see on the screen? Normal carpal tunnel. Can you see here? Normal tunnel is like a hollow space. Normal carpal here, carpal tunnel. Transverse carpal ligaments are there. Then most important in the median nerve. In that particular hollow space, median nerve is passing. Median nerve, and that median nerve is get compressed here in the wrist area, and that's why this particular group of symptom is called as a carpal tunnel syndrome or carpal tunnel symptoms. Median nerve is compressed. That is the most important pathology to be remembered. Carpal tunnel syndrome, CTS, or median nerve neuropathy. Due to the compression of the median nerve, because it is traveling through the wrist at the carpal tunnel here, most of the cases are idiopathic. Idiopathic means cause cannot be known, cause cannot be explained, cause cannot be found. The only word is idiopathic. And most commonly caused, there are probable causes by repetitive, sustained or forceful motion occurring over time, especially lawn tennis, a sports activity with your hands, then it is can take place, that carpal tunnel syndrome, compromising the integrity or the functioning of soft tissues and producing inflammation of the tendons or compression of peripheral nerves, or there may be a type of trauma. Clinically, carpal tunnel syndrome is characterized by multiple alterations in the motor activity or in the sensory activity. For example, there may be nocturnal paresthesia. At night, you get problem. For example, numbness is there. Tingling will be there. Decreased sensitivity can happen. And pain in the territory innervated by the median nerve. Decreased grip strength. This is my grip. So I cannot hold properly, or I cannot make a very good shake hand. Decreased grip strength and atrophy of the thinner eminence. This is thinner. Eminence means a protuberance. So there will be atrophy, loss of muscles over here. Loss of muscles. Atrophy of the thinner eminence. Carpal tunnel syndrome cannot be correlated to a particular disease condition in Ayurveda. But the upper limb, hands, upper limb pathologies are described under the category of Vata Vyadhi in Ayurveda. Vata Vyadhi are moreover neurological problems or musculoskeletal problems according to Ayurveda. In this particular research study, considering the involvement of Vata dosha with here Mausakshaya, muscle atrophy, Mausakshaya, treatment was planned by the researcher accordingly. So this is also a research case report. Patient's information, 62-year-old female with complaining of severe pain over here with numbness and tingling sensation on the right hand with involvement of wrist, thumb and index finger. Wrist, thumb, index finger. For 2 years and for the last 6 months, the lady was experiencing weakness in the right hand. She cannot hold the glass or these things properly. So weakness of the right hand. When the doctors start local examination here, it was elicited that the patient had a positive Tinel's sign. This is a typical feature of the Carpal Tunnel Syndrome, Tinel's sign. On performing Phelan's test, instructing the patient to bend the wrist forward completely for 60 seconds, numbness and pain increased. Numbness and pain increased by this Phelan's test. The pain was assisted by VAS, VAS, a typical scale to measure the pain. Visual analog scale, VAS, visual analog scale to determine the severity of the pain in the research modality. So VAS score was 8. 0 to 10. So 8 is a good maximum pain is there. Signs and symptoms like pain, prasupti, that is numbness, and balhani, loss of strength, were the symptoms. So first, Panchakarma was advised and it was done by the researcher. Ekang, only one part, only specific part. Ekang, Sarvanga means full body. Ekang Snehadhara, pouring of the oil on wrist, here, carpal tunnel, here, pouring of the oil. Kottam Chukadi Tail, medicated oil was poured on the carpal tunnel for 45 minutes every day for 15 days because it is a Vata problem, Vata dosha imbalance. Then Shali Shashtika Pindasveda. Shali Shashtika Pindasveda, 45 minutes for 15 days was given. Then what? Shamana Chikitsa, internal palliative treatment. What was Shaman Chikitsa? First tablet, Yogaraja Gugulu. Yogaraja Gugulu, 500 milligram, 2 tablets, morning and evening with lukewarm water after lunch and after dinner. Then Maharasnadi Kwath. Kwath means decoction. Maharasnadi Kwath, 20 ml, 2 times in a day with equal amount of water before lunch and before dinner. Then Rasa Raj Rasa tablet. Rasa Raj Rasa, 125 milligram, 1 tablet, morning after lunch, evening after dinner. Ashwagandha Churna powder, 3 gram, morning and evening with 1 cup of milk, that is 250 ml of milk after the food. Now, how that research is discussing these points? The pathogenesis of carpal tunnel syndrome in Ayurveda, parlance, can be a Vata Vyadhi, can be correlated with Vata Vyadhi, that means disease of the Vata imbalance. And hence, it is understood that the Vata dosha, with its potent qualities, Like Ruksha means dryness, Sheet means cold, Vishad means clear, Laghu means light, initiates the pathology. In this video, you can see that Dr. Deshpande is trying to introduce some Sanskrit words for better understanding of Ayurveda and also giving parallel English words. Sanskrit, English, Sanskrit, English. Okay? Shita Guna of Vata dosha interacts with the Kandara, that is the ligaments, and results in Vyana Vayu dysfunction, resulting in Margavarodh, that is obstruction to the route of conduction. Nerve conduction was not there, obstruction. And that is why there was prosupti, numbness in these particular fingers. And also because of the Vata dosha, it was shoshana or the wasting or the atrophy of this thinner muscle eminence. Then sneha dhara, when we are pouring the oil, that definitely improves the motor and sensory systems, resulting in improved function of the hand and also the forearm. Shali Shashtika Pinda Swed. Shashtik Shali. Shali is a rice. This is a Svedan, which works as balya. Herbs which increase the strength and are tonifying. For example, Bala plant is always used in this particular procedure. It is balya, it is strengthening for the muscle tissue and also osseous or the bony tissue. Kottam Chukadi Tail, medicated oil, has dravya with lekhaniya. What is lekhaniya? Herbs that can reduce the fatty tissue and that can help for the weight loss in the patient. Then this is also Shul Har, antispasmodic or analgesic, and Shof Har, anti-inflammatory properties, Kottam Chukadi Taila. This results in the improvement of the motor and sensory system, resulting in improved function of hand and the forearm. Carpal Tunnel Syndrome we are discussing. After 15 days, Shashtikashali Pindasveda was done for 15 days. This Shashtikashali Pindasved is also known as in South Kerala or the Kerala part of the South India, Navarakizhi. Navarakizhi, this treatment. This is a Balavardhak, increasing the strength of the patient and immunity as well. And Deh Dardhyakar, that means it will make the body of the patient very much strong. Heat is provided, which increases the blood flow over here locally and helps in reducing the nerve stimulation, and it causes the muscle to be relaxed. Bala, rather Bala plant is balya, strengthening for mouse means muscle tissue and asti dhatu means osseous tissue. Shamana Chikitsa, palliative treatment for carpal tunnel syndrome. Yogaraja Gugulu is a combination of drugs having properties like Ushna, hot in potency, Am Pachana. Am is like a toxin, so it is digesting the poorly digested food, that is Ama. Shothagna, anti-inflammatory, Vatahar, taking care of nerve irritation, and Shulagna, that is analgesic or reducing the pain. Yogaraj Gugulu. Next medicine is Rasa Raja Rasa. Rasa Raja Rasa is balancing all Vata Pitta Kapha and also strengthening the body tissues. Maha Rasnadi Kwath, that is a decoction, also reduces the pain and inflammation. Ashwagandha Churna, Withania somnifera powder, was given as a balya in strengthening nutrition nutraceutical, and has a rejuvenating effect and also pacify the imbalanced vata dosha. So what is the conclusion, my dear friends? Carpal tunnel syndrome is a disease with poor prognosis and very difficult to treat without surgery. In Ayurveda, there is a hope for such kind of disease to be get cured without surgery. It can be concluded that Sneha Dhara, pouring of the oil, and Shashtikashali Pindasved, fermentation, along with oral Ayurvedic formulations, are very effective treatment modalities in carpal tunnel syndrome. My dear friends, if you have any physical, psychological, emotional problem, don't hesitate to take the help of expert team of doctors in Ayurveda Academy. Just WhatsApp on 9226810630. डिस्क्लेमर, कौन सी भी बीमारी में यथावश्यक यथाकाल वैद्यकीय सलाह लेना बहुत जरूरत है. My dear friends, please like this video, share this video, and don't forget to subscribe my YouTube channel. I wish all the best, take care, and see you in the next video. Thank you.